Hello, everyone. We should be live now. Welcome this evening to this installment of the Blended Pack. Now, my name is Janie Budnick. I am a pet business owner myself, and I am also a proud volunteer and honored to be able to present to you this Blended Pack this evening as a representative of PAC, which is the Professional Animal Care Certification Council. Wanted to share with you a little bit about PAC. I know we do have quite a blended audience this evening, and many of you might not know who PAC is and what PAC represents. So let me pull up my screen here. Fabulous. Okay. So we are going to have this wonderful presentation this evening, but let me tell you a little bit about PAC. All right. Work for me, right? Hey, that's the way things go, right? Okay. What is PAC? So we are actually a non-for-profit organization, and we do have a volunteer board of directors, also volunteer advisory board, and other supporters like myself. Now, we are represented, of course, by a panel of industry experts who really recognize that standards are necessary in our industry because unfortunately, there are no standards directly in the pet care industry. So we have actually developed independent certification, third-party independent certification that is using industry standards to provide that high-level certification of the pet care industry. Now, here is the mission of PAC. I'm not going to read it all to you. I know you're able to read, but really bringing that independent testing and certification to the industry. We have all seen the reports on some of the unfortunate things that do happen in different pet care situations around the United States, absolutely. Globe, definitely. We're seeing them really everywhere. And so here really in North America, we are working very hard to develop those standards for this industry. And not just internally amongst ourselves, but really be able to communicate that to pet parents as something that they should be looking for within any of the pet care providers that they use. So whenever you do go through certification for PAC, you do receive your 3-year certification. This is a very challenging test. I am also a registered nurse, and I was sweating just as much getting my CPA-CO and CPA-CP as I did passing my my NCLEX for my nursing degree. So there are 3 different levels of certification that you can receive. There is the CPACP, which is the provider level, CPACM, which is for the manager level, and then the CPACO, which is for the operators level. So very important. There are different standards for each one of those tests for you to be able to sit for those. And why is PAC important for your business? As I mentioned before, of course, we don't have any current standards, and there are a lot, most professional industries do require some kind of independent certification. So what we provide in PAC is not providing you with the education. What we are doing is we are testing and certifying that you know what best practices are. You know what industry standards are for that. So we do have definitely a commitment to excellence for the entire industry, and we really hold people to very high standards for that, which provides so many benefits for your business. Now, for pet parents, of course, this gives them something to hold on to. It can be really challenging in the pet industry to tell this one from that one down the road. And by being able to display that you have PAC certified members at your facility or in your in-home service, whatever you do have, it is really showing that there is becoming that standard and that regulatory best practice, which really provides a lot of confidence for our pet parents when they see that logo. So just to let you know, there is one opportunity left this year for exams. There is, of course, the registration deadline is October 13th. The testing window is the 9th through the 23rd. If you are interested in PAC, I definitely encourage you to take a look at our website. Additionally, you can go into one of our groups on Facebook. There is also a study group. There are practice tests that you can take. We have a lot of opportunities for you there. So I appreciate you taking the time here to listen to some information about PAC. And it looks like we have a lot of people here with us live. Just wanted to get a head count. I know, like I said, we are a blended group. So give me a 1 in the messages if you are a veterinarian here listening as a veterinarian, and give me a 2 if you are with boarding and daycare or some other industry. Just want to see who we have represented right now. All right. See some 1s. All right. Veterinarians. Wonderful. Okay. I see some 2 coming in. Good. All right. Wonderful. Okay. This is a great mix. So happy to have you guys here. Thank you so much for joining live. And those of you are on the replay, hopefully you get a lot of information about this to help you. I'm going to go ahead and bring on our special guest, Dr. Jen the vet, who is going to be talking to you, of course, about leptospirosis. So wonderful. Welcome. And little housekeeping. I'm going to run interference if there are any questions that I see for you. Otherwise, I will let you take it away.
Okay. All right. So, as they say, like, we're live, we're hot, we're rolling. Hopefully you guys can see a slide right now, and not just my face. I did have Cosette's little platform here. She had promised me that she would make an appearance, but now she has retired to the couch. I don't know. I don't know what happened. I guess like the timer went off for her and she's out. And I feel like at the end of the day,
cute.
Right, she was cute. But it's like at the end of the day, we do the same thing. All of us that work in pet care, like our timer kind of goes off. So I very much appreciate all of you who have joined us this evening live, because it does take a little bit of extra commitment to get yourself here, even if it's virtual. I know. So thanks for that. And I am still seeing, there's a small delay. So I'm still seeing a lot of folks kind of ringing in with your number corresponding to what part of the industry you're from. And I will say, Cindy, thank you for typing. You're a veterinary assistant. We didn't really have a category for that. So yeah, so wonderful. I think we probably have a very heterogeneous group here, which I'm excited about because everyone has a different perspective. Okay. So, and I'm dating myself a little bit because you can see with my title slide, I could have put extra instead of extra, but I thought maybe too many people wouldn't get it. So extra, because some of the things we're going to talk about are quite newsworthy. However, if you've been following data for many years and understand the pathogen, they shouldn't be news to you, but they might be in their application. All right. So here we go. We're going to get started. All right. Okay. Yep. Okay. So this is about me. First of all, I am Dr. Jen the vet. If you can't find me on the internet, you're just not trying. For those of you who may not be aware, I do have a program called Dr. Jen the Vet's Healthy Pet Keeping Seal. And there's my website. You can find more information if you'd like. Okay, so conflict of interest disclosure here. I feel like we should do these at the top of every single presentation. I am not getting paid this evening. I make no money from this. Neither does PAC, frankly, but they are willing to host it because PAC leadership and myself really believe in the fact that we need to have more cross-industry events so that we have the pet care folks, the pet care professionals, as well as the veterinary medical professionals talking across the room, right? In the triangle of pet care, which is the owner, the veterinarians, and the pet care facility, we need to have more crosstalk between the pet care professionals and the veterinary industry. Okay. However, I will say that I have a friend, a colleague, she's a wonderful dermatologist, Dr. Joya Griffin, and she sums this up nicely when she says, there are some companies that I date. I'm not married to them, but I date them. So I will go ahead and tell you, I date Merck Animal Health. I'm Merck adjacent. I don't work for Merck, but I do collaborate with them on a lot of things. And this evening, while I am not being paid by Merck, they are providing the race CE approval. So thank your Merck Animal Health rep for that next time you see them. Okay, so it's not complicated, but there it is. Okay, so I put this up on socials this week or last week, and I said, what pathogen is Cosette? That's my dog Cosette. She's campaigning to be the poster child for what pathogen. And a number of people popped off with Lepto right away. Look at her. Look at her, right? This is a puddle that forms in front of our barn at the farm. I did wash that harness before I threw it away because I did throw it away. Anyway, Cosette did have babies this year. I put this picture in most of my slide decks because it makes me very happy. And they're beautiful and I love them still. And I love that she is definitely my dog with a little bit of OCD and love of patterns. So she had her dogs in pairs. You see two blues. Well, one's a blue fawn, but still two blues. And you see two sable puppies in the middle and then two chocolates. And they are, let's see, they left me before May 1st. And then the two sables just got castrated this week. Look at them. They're so beautiful. I just love them. And that's their older brother there. He's 6 years old and he's upset he doesn't also have a onesie. But are those not the most adorable puppies? Okay. So I put this in here to also share with you the fact that I love some little dogs. And so we're going to talk about Lepto, which historically has been a problem of big dogs, or we thought it was. Okay. So here's how we're going to start. The comment or the chat box is open. So if you have a question, don't hold it to the end. I want you to pop it in there. And we're going to do some interactive cases first. Then I'm going to share with you some info, which may be new to some and maybe a good refresher for others, but probably each of you will find something new in there. And then we'll pull it all together at the end. All right. Okay. So to get started, I want you to take your cell phone and I want you to send Jennifer Chat 820 to that number. So send a text message to 22333. And where I come from, we spell Jennifer with one N only. So the message you want to send is Jennifer Chat F820. And when you do that, you should get a message back saying you've successfully been put in the Cool Kid Club for the evening for polling. And so once that happens, if you'll just put like something in the chat, put a Y, put an 8, anything. Oh, and all flattery towards Cosette will be welcome. So thank you, Dr. Mendez, for that. All right. And there is a slight delay. So I am going to give a little moment here for folks to get the text message sent and get the confirmation so that we can all move through the cases together. All right. Thanks, Josie. She got it. She must be wicked fast. Just want to see a couple more folks get their confirmation in the chat and then we'll roll. Oh, good. Here we go. Done. I like it. At the end of a day like today, done. Yes. Done. Ah, Dr. Minute. I know Dr. Mendenhall, so I'm going to say this directly to her. So impressed. Love it when technology works for us. All right. Okay. Oh, and an emoticon. Okay. All right, folks. I'm gonna move forward because I feel like everyone's seen that slide for long enough. Okay. So we are going to start with the cases, and these are going to be the rules. You are all working at Utopia Animal Hospital. where money is not a factor. And I don't mean that it's not a factor like sometimes we feel it is when people say, I don't care what it takes, how much it costs, because I'm not going to pay for it. No, this is real. Money doesn't matter. We're going to say yes to whatever. You're only going to get to pick one choice, okay? And now I know not everyone in the group is a veterinarian, but I also know that if you've worked in pet care for 10 minutes, you've seen a lot and you've heard a lot. And so there's no harm, no foul. I want everyone to give me a guess of what you would do, right? Okay. And also, these are anonymous. No one can see it unless you put your choice in the chat, and then we'll all see it. Okay. All right. So here we go. We're going to move to the first case. We are ready to go. Let's start. All right. Case number 1. This is, you're looking at an 8-year-old castrated male Yorkie that the owner is complaining that their dog is lethargic and they haven't wanted to eat for the last 4 days. 2 days ago, they started vomiting. They were perfectly fine before. The owner doesn't know what's going on. They were up to date on vaccines and flea and heartworm prevention. Now, when you go into the exam room to look at this little fluffer, you find that he is indeed depressed and lethargic. His temperature is 101.3. You see his heart rate there is 84 beats per minute. His respiratory rate 36 per minute. And he does seem to be a bit dehydrated. Okay. And there's a little bit more history there. He lives in the city and he's up to date on his vaccines. All right, folks, I would like to know what you would like to do next. Would you like to do blood work? Would you like to do urinalysis, radiographs? Or are you ready to treat and street? So we're going to give just a minute for y'all to put in your choices. And blood work is going to be like a CBC and a chemistry. That's what you're going to get. So it should start to populate. But there is that little delay. All right, folks. If you are not having success getting it in there, you can also put your choice in the chat, and we'll see how that works. Okay. Well, we've got a small split there. All right. I see some folks are ringing in with A in the chat. Thank y'all so much for doing that. There's a delay with the streaming service, and then there's a delay with the polling. And so that may be what we're feeling here. All right. It does look like, though, that blood work is winning out, even with our non-veterinarians. Thank you so much, Stephanie. I feel like if you've been to the veterinarian with a sick pet at any time, you also have a good guess. Okay. Blood work. Ooh, Cindy, probiotics while waiting for the results. It's Utopia. Cindy, how long are you going to have to wait in Utopia? Okay. So we're going to go with blood work here first. It looks like that's what pretty much everyone's picking. All right. So here are your results from the blood work. So you can see this dog is slightly anemic. No one cares about the thyroid levels, or at least I wouldn't care in this situation today. And then what you have there in the parentheses is the normal reference ranges for a dog from that lab. So you're looking for stuff that's out of that normal range. Okay. Going to wait for everyone to get a chance to have a look at it. All right. I'm going to go back to our case. So the second choice, actually by a lot, like I think probably it looks like only maybe one person actually put in I'm looking at the numbers. I think, okay, so we had some outliers. We had like 5 or 6 people that said they wanted a UA. All right, so I'm going to give you your UA, and here it is. This is your urinalysis, and you did collect it the hard way, right, with a UCath. And this is what you're finding. So there is red blood cells in that urine. That's those erythrocytes. You've got some protein, some white blood cells, and a specific gravity. All right. Now I'm rolling back. So now I'm going to ask in the chat if anybody is yet ready to treat this dog. Anybody ready to treat this dog at all? All right. I love Melissa who wrote in the chat. She really was like wanting to structure this path forward, and she said blood work and then I want the UA. So we got that, Melissa. We got that for you. All right. So let's see if anybody is ready to treat and street. And if so, what would you treat it with? For kidney issues, yes. Scott, exactly. Some fluids. Michaela, God bless you. You are my people. I want everybody to have fluids. I think every sick creature of any kind needs fluid support. All right, so I'm going to go ahead and I'm going to click treat. All right, so you treat this dog, and during this period, the anemia and the electrolytes remain within normal limits. So the anemia got fixed, but the kidney values actually remained elevated, despite the fact that you were administering supportive care with pretty aggressive IV fluids. The dog seemed somewhat brighter on the 4th day. Oh my God. We were treating this dog for 4 days. Yeah, after 4 days in the hospital, Jenny, he's ready for a treat for sure. So on the 4th day, the mucous membranes and the sclera, the whites of the eyes, had become jaundiced. They turned yellow. So when you repeated your blood work, it turned out that it had improved a little bit, but the liver enzymes were elevated and there was lots of injury going on. And so what happened with this dog, you repeated your UA as well. The kidneys were no longer concentrating the urine. Now you had bilirubin in the urine, you had higher protein, all kinds of stuff. And so you did a fancy test that only in Utopia would you have that at your clinic. You did immunofluorescence and you found leptospires. You found leptospirosis in this dog. All right. And listen, these cases that I'm sharing with you, that's the reference right there. This is a published case report. If I had made this case up, then it definitely would have been more perfect. Okay. So yeah. So this dog was positive. And I know some of you are typing in the chat that you want to send for urine and serum out for a PCR for lepto. Love it. I love Dr. Stone would have tested for Lyme as well. But yeah, so this dog definitely had lepto because we found it in the urine. So that PCR, Dr. Mendenhall, would have been positive for sure. And you might be wondering, okay, so what? The acronym WIFM, if you've not ever heard it, it stands for what's in it for me. And that is sort of the face I like to give when I'm thinking, what's in it for me? Why am I talking to you about this case? This dog, if you recall at the beginning with the history, was up to date on vaccines. And had we been in a live thing and you said to me, what does that even mean? Because you should never just take for granted the fact that someone says something is up to date on vaccines. You need to know which vaccines is it up to date on and what does up to date even mean? So a better question is, when's the last time this dog was vaccinated and how, right? Okay, so this dog was up to date on vaccines, but it was only given a bivalent lepto vaccination. That's it. Instead of the quadrivalent, the vaccine with 4 types of lepto contained. So you don't get cross protection with lepto. So just because you're vaccinated against one doesn't mean that you get any protection against the others. And so it is important that dogs be vaccinated with that quadrivalent lepto. So you need to consider what your vaccine choice is labeled against and what it is not. And facilities, you need to consider, are you just requiring any lepto vaccine, or are you requiring the one that protects against the most? Because that's what we want to do, right? Okay. All right. Case number 2. And I feel like the delay is impacting us here, but I'm going to press forward, you guys. Okay. So case number 2, it's an 8-year-old intact female poodle that presents anorexic, lethargic, and with a mild cough. So you head into the exam room and you're chatting with the owner. And the owner says, this has been going on for a few days, but they didn't come in until the cough started, which was yesterday, because she's 8 and she's kind of been slowing down for the last few months or maybe the last year. But you know what? She threw up last night and I found it this morning. And right now you're all thinking, how did the owner find that puke on the floor? Well, they stepped in it naturally, barefooted at 6 a.m. So they've been sitting in your lobby waiting to be seen. So on physical, when you examine this dog has horrible periodontal disease, horrific halitosis. At least you hope it's the dog. And the dog does cough, and it's a deep and productive cough. There's no oculonasal discharge from this dog. The heart sounds okay. Wait a minute. I'm listening. Wait, I think I hear it. Oh, yes. The records say that this dog has had a heart murmur since it was a baby, and there's mitral regurgitation. So I definitely hear that heart murmur now. Whew. All right. There are decreased respiratory sounds bilaterally. So you think that they're decreased because they're hard to hear over the owner talking. The abdomen is soft and palpable. The dog appears to be moderately dehydrated. Mucous membranes are light pink and sticky, and the dog is lethargic. It does seem a little less than bright. This dog was boarded for spring break about 3 weeks ago. It's up to date on vaccines and on flea and heartworm prevention. Okay, so I know you guys know what is coming now, and here's our choices. So what are we going to do next with this dog? Are we going to do blood work? Are we going to do x-rays? Anybody ready to treat this dog? Or do you want something different? And if you want something different, another piece of information that's not reflected here, just type it in the chat. Or if you have a question on the history, something else you just want to make sure of, type it in the chat. All right. Okay, well, we have a fairly even split here, friends, between blood work. Those of you who are picking x-rays, y'all are not my people. I never pick x-rays first. If I'm working with you and I say x-rays, you could just know, man, she really doesn't have any idea what's happening. Okay, listen. Oh, Dr. Keel, thanks for joining us. Listen, those of you who are picking multiple things, I've done told y'all we're in utopia, but you can only pick one thing at a time. So, okay, so blood work. It looks like blood work is winning out anyway. All right, I'm going to click over to blood work, folks. All right, here is your blood work. All right, y'all are my people. I love blood work from off the bat. I like it from the jump. Okay, here's your CBC. You see that hematocrit? We got the chemistry and the thyroid. We just threw the thyroid in there because the dog is old. It's 8, and we were getting it anyway. All right. And for those who are non-veterinary in the audience, it's not that I was lazy putting this together and giving you the blood work results there, but those 2 liver enzymes there in the chemistry, the ALKP and the AST, we don't really care about those values until they're at least 2 times normal. So to me, it doesn't matter if normal is 100 or 150. I don't care. I need to know how many times normal is the level that I'm finding, right? So 2 times normal is a totally legit way to put that. Okay, I'm going back. So now I am going to go ahead and show you x-rays because we did have a good split there that also wanted to see x-rays. So let's see what our radiographs show. Okay. Oh, Melissa, with your question in the chat, you are a woman after my own heart. Yes. So we're going to get to that. We're going to get to that question. If we don't get to it, you put it back in there. But I think that also Janie will keep us honest. Okay. That's your x-ray results, friends. Yeah. That's why I don't like to do x-rays, because that's usually what happens. Okay. So some people were ready to treat. I think probably by now people are saying, well, could we treat what we saw on the blood work? Because we did see some elevation. I'm going to flash that up again. You see the elevation here in the kidney values, the BUN and creatinine. And so we would be ready to treat that. Dr. Keel's looking for some abdominal rads. Okay, I'll go ahead and give you the results for abdominal rads. Yep, those were normal. Yep. That's about what I get from rads. Oh, you want a UA. Okay. So Robin wants a UA. So in the urinalysis, the specific gravity was 1010. The urine was clear, no white blood cells, no crystals or casts, and no blood, no red blood cells. Yep. Anything else somebody wants different? Because I'm ready. I've got all kinds of results here on this case. I'm ready. Okay. I'm not seeing too much here. So I'm going to roll on and we're going to treat these clinical signs. I think we're ready for that. Unless somebody wants to put something in there. I mean, this is a lepto lecture. There's that 10-second delay. I'm going to try to send a text to someone so they'll pop in the chat and say, hey, Dr. Jen, can we test for lepto? All right. Well, you test for lepto and it's negative. All right. How did you test for it? I don't care how you tested for it. It was still negative. It was still negative. Okay. All right. We're going to treat clinical signs. So you get the owner to agree to treat clinically. You put this dog in the hospital on some aggressive. Thank you. Thank you guys. Finally, let's do lepto test. Appreciate you. Yep. Test for lepto. Yeah. So your lepto test was negative, as I mentioned. You did get the owner did agree to hospitalize this dog. And so you put it on aggressive care for what you saw, which were the changes in the blood work with the kidneys. And so you get a good response, but probably just because the dog gets rehydrated, because the isostenuria, the urine that's not concentrated because the kidneys aren't working, it still is persisting. Okay. And so what does that mean for you? Well, it means that this dog has kidney failure. That's it. This dog just has kidney failure with an anemia of chronic disease that we routinely see and an acute aspiration pneumonia. Now, I will tell you, knowing now that we have a boarded pathologist in the mix with us, to see that aspiration pneumonia like that radiographically, that didn't happen last night or early this morning. That probably happened a few days ago. And so I would tell this lady to look behind her couch because that dog's probably been vomiting and she just hasn't stepped in it yet. Okay. So we had a lot of questions in the chat about doing the lepto snap test, doing a lepto PCR. And then we had our pathologist said, which lepto test did you do? This dog was negative on all the lepto tests that you want to do. This dog doesn't have lepto, but this dog also wasn't vaccinated for lepto. No one asked. I said up to date. This dog wasn't vaccinated for lepto either. So it didn't have a titer. So you could do the snap test that Misty put in there, and you could get a negative on that. Honestly, you could get a positive too. I could tell you it was positive. And then I would ask you, which of the snap tests did you do? Because they're not equal. They're looking for an antibody titer, one that can be produced by disease or one that can be produced by a vaccination. Depending on which one you use, you have to interpret the answer that way. You could do a lepto PCR and it would be negative. Still doesn't conclusively mean you don't have lepto. It means you have a negative PCR. Now, if you do a kidney biopsy and send that into the pathologist, you might get a better answer. You can trust your negative. But I would say all the things pointing to no lepto here. And so this truly was not a lepto case. This was just regular old kidney failure or kidney disease in an older dog. And the dog, to complicate it further, was coughing that productive cough because they aspirated on the vomit. And so now they have a pneumonia, right? Okay, so now we get to what's in it for me with this case, because dang it, we tested it every which way for lepto and it was negative, and it's not even a lepto case. So just like this dog is looking under the fence, if you're looking under the fence, you can't see the whole yard. You just can't. Not as well as if you just open the gate. And so when you're looking at a dog, whether you're at a pet care facility or whether you're in a clinic looking at a case, it's important that you not sort of preconceive of what's going on, because not every case, even in a lepto lecture, is an infectious disease case. And real world cases or real world disease in dogs can be tricky if you start with an incomplete list of differentials, and you'll miss stuff. You'll miss stuff. Okay. This is my last case for this. Okay, folks, so hang with me. You guys are really engaging. That's wonderful. That's right. Dr. Mendenhall says she doesn't ever believe in owner. This says vaccines are up to date. Lets you see the records for yourself, 100%. That up-to-date phrase will get you every single time, folks. Okay, so our last case is an adorable 8-week-old female lab puppy that's been vomiting this morning, and she's had diarrhea for the last 2 days. And the diarrhea has progressively become more frequent and smellier, according to the owner, right? She hasn't wanted to eat starting last night. And she is up to date on her puppy vaccine series. And she was dewormed by the rescue or the shelter prior to being purchased. The owner also does hand you a legit health certificate reflecting a negative fecal flotation from 4 or 5 days ago, and also reflecting the aforementioned deworming. Naturally, it was with Strongyt. Okay, so you know we're coming to this. What do you guys, well, this is what you see. Sorry, this is what you see on your physical. The dog's depressed. It is vomiting. It has diarrhea. It is dehydrated. That 1021, maybe a fever, also just a puppy. And the mucous membranes are pale and tacky. This is a sick puppy, okay? All right, so let's get to what we're going to do next. Do you want to do some x-rays, some imaging, actually? What worming medication? It was Strongyt, Pyrantel. Are you worried about parvo? You might be worried about parvo. The parvo test would be in the fecal float direct or other choice. Josie, you have to pick one, parvo or blood work. Parvo test or blood work. Parvo test or blood work. A lot of people want x-rays so far. Okay. I will go ahead and let's see. Ooh, okay. I'm not going to go ahead. I'm going to wait for y'all. Look at everybody. Oh, Dr. Mendez, you're sneaky with the centrifugated fecal. Okay. Josie, I'm with you. I always want blood work. I always want blood work. Okay. I'm going to cut it off here. I'm seeing a whole lot of people wanting more than one thing, but in where you get to pick one thing, people have chosen mostly the fecal float direct and other. So there you go. Your fecal float, no parasites seen. The direct, you have like a 2+ Clostridium. The other test, there's a big roar in the chat for a parvo test. And I'm going to tell you that the parvo test is negative. And now the parvo test is one Stephanie put in there. She's not a vet, but what that test is. So that test is, it's just like a fecal swab, really kind of a rectal swab, where then we do a little ELISA snap. So we call it a snap test. You can have a negative parvo test and still have a dog with parvo. It's true. But I'm going to tell you that this parvo test is negative. All right. Let's go back. All right. So now all you fecal and parvo testers, most of y'all said blood work, but we did have a mix of blood work, but x-rays got 20%. So I'm going back to x-rays here. So let's see some x-rays. Oh, look, they're totally normal, right? Okay, I love that. Yeah, that's pretty routine here. But that does help us rule out anything significant like a really blatant foreign body that might be causing an obstruction. All right, blood work, friends. All right, here's your blood work. Blood works. Bum, bum, bum. Right? Yep. Okay, so the blood work is helpful. We're looking at it for a minute here. I see our kidney, things we look at for kidney, the BUN and creatinine, those are both through the roof. The phosphorus through the roof. Total bilis high. That ALKP and ALT, the ALKP especially, through the roof. Now it can be, the liver enzymes can be elevated in a puppy normally, but that's really elevated, okay? All right, so I'm gonna go back here. Anybody wanna treat this? Treat for parvo anyway, I love it, while getting x-rays and blood work. Yes, this puppy needs help. It doesn't really matter what your lab work tells you. You're not gonna go wrong with this puppy on giving it some aggressive fluids, some more fluids. How about some fluids? A little bit of fluid, yep. So we wanna get that caught up. All right, shall we treat? Let's treat. So we start this dog on aggressive fluid support, okay? We stop the vomiting. That's that meripitant, right? That's our Serenia that we love. Unison, that's our antibiotic we're going to start him on. Famotidine for a belly that's on fire, a little metronidazole, and probably almost anything else you want to give. The electrolytes on this dog were deranged, and so we did start. We added those, Joe, into the bag. You see that with the 1 ml of vitamin B complex, the 20 MEQs, and our lactated ringers. Okay, so a urinalysis. Well, we couldn't get any urine, Dr. Keel, from this dog. He was so dry. But I'm going to cut to the chase here on this one because I think this one is going to be a little bit surprising. So despite your best efforts, even with aggressive supportive care, this dog continues to decline. And following little to no change in peripheral blood work after 24 hours, these owners made a hard choice because the likelihood of a reasonable outcome for this dog was really, really low. And one of those reasons is because there was a lot going on. Okay. So this dog was very sick. So we had changes in the lungs. We had changes in the liver and kidney, changes in the heart. And then they did confirm on the necropsy that this dog had leptospirosis. And here's what it looks like. If you were truly in utopia and you could get this cut section and staining done immediately, you would see that those little brown squiggles in the kidney tissue are the leptospires. That's the lepto. That's what it looks like. And so this dog definitely suffered from severe leptospirosis. Is this real? Well, I told you that I was using real cases. There's the reference for it. Now I'm super glad I did because Dr. Keel's a pathologist and she would definitely hold my feet to the fire. But this is a published case report. And in fact, in a different study, when looking at cases of acute fatal lepto, 90% of the acute fatal lepto cases were in dogs that were under 6 months of age. So if you've been rolling along through your life thinking that young dogs don't get lepto, welcome to reality, they do. Most of those young dogs presented with GI signs, right? And it looks like parvo. Everyone thought parvo, but it turned out it was lepto. So it was very difficult to diagnose as well because the titers were low in these dogs, even though they had fulminant disease. So it is real. So again, with this case, what's in it for me? So Joe, were any of the puppies and any of the other puppies in the litter affected? You know, I don't know. I don't know that that was in that case report. I don't know if they had that history to look at. But even even if we didn't know about the rest of the litter, what's in it for you with this case is that you should know that young dogs can have lepto. And in fact, I have a friend now who's texted me twice in the last 3 months from an emergency clinic because they had a dog that was the dog was, I think, 9 weeks old, and the other one, the dog was 13 weeks old, and they were positive. They had lepto for sure. And they were really, really sick. You should be requiring lepto. You should be giving lepto to puppies, giving the lepto vaccination. Okay, so those are my cases. Thank you all for playing along. You may now put your phones down if you like, because that's all I have for you with the polling. So I'm going to move through sort of some of the news flashes that have been coming up in veterinary medicine lately. So in late 2023, the internist published, the ACVIM, the American College of Veterinary Internal Medicine Specialists, published their updates on canine leptospirosis. And I'm putting this as a daily news thing, kind of as a little bit of a tongue-in-cheek, a little bit of sarcasm for you, because I don't think it was news. I think it was news that their committee finally came together and was able to put out recommendations they could agree with, but it wasn't news for us. So for instance, here's something. All dogs are at risk of leptospirosis, regardless of any other characteristic about them. The fact that they're dogs and they're alive means that they're at risk for lepto is basically what they said. Now, many of us have known that, but that's what they came out with, a statement that said, listen, lepto's a bacteria. And here on my obligatory nerd slide, which is what you have to show when you talk about infectious disease, I got to tell you something about the bug itself. Bacteria live in warm, moist places. I don't think that's rocket science. I think everyone sort of presumes that there's bacteria living in warm, moist places. But what I do think is interesting is that if I asked you to put in the chat right now where you are, and I'll tell you if you have lepto there right now, no matter where you put, even our friend that typed in from New Zealand, I'm super jealous, you're in New Zealand. Yep, you got lepto, right? Because look at this. Lepto is present worldwide and is there all the time. Now, it may be there in greater numbers during certain times than others, but it's there. It is there, people. And that last one about the increased rainfall, here we go. This is looking at confirmed lepto cases, the global burden for it. The darker it is, the more that it's been confirmed there, and the higher the impact. It's not a shocker that it is in the equatorial regions of the world. Okay. I don't think that should surprise anybody at all, but just because you're not in a tropical oasis doesn't mean that you don't have lepto, right? I know Josie says she's in Mississippi and it's thriving there. True. But it's also thriving in Minnesota, right? And it's also thriving in the desert of Arizona. Okay. So just because they peer reviewed it and they did a wonderful graphic to go along with their article, I like to pay homage to those folks who do that. And they look to see, they being science, they look to see if lepto would indeed sort of outcompete the other bacteria that may be available in the environment with increased rainfall. And lo and behold, it did. And lepto outcompeted Pseudomonas and took over as the dominant bacteria present. And so I think it's good to know that only for when we can talk to clients, because clients have heard all kinds of stuff about lepto on the internet. God bless the internet. Okay. So we know that dogs are at risk for lepto because they're alive. Cats are also at risk. Dr. Keel popped that in the chat. Thanks for bringing that up. I'm going to talk about cats at the end as kind of like an addendum. Well, I'll just say it here. Yes, cats actually can get lepto. They can become infected with the pathogen, and they actually can manifest clinical disease. However, it's really, really rare, like exceedingly rare. Like, you don't need to worry about it necessarily. And if you diagnose it in a cat, I think you could probably write a paper, right? So, but we do know that cats can get it. Okay. So our next thing that they came out with in these latest guidelines from ACVIM was that lepto is a disease of social dogs. Now listen up. Just because I'm about to talk about social dogs, I would like for the veterinarians to listen up here, because I think that for us, this might be news. And for those of us working in pet care facilities, we should be requiring lepto because of the potential zoonotic risk to all of us that work there, right? But sometimes it's difficult to get veterinarians to recognize that as well. And so, first of all, is being social as a dog, does that increase your risk for infection with lepto? Well, they looked in Arizona. Every year in Arizona, in the United States, it seems that there's an outbreak of lepto. And so they started looking at, well, what are the risk factors for these dogs developing lepto in a region where lepto is not as common, right? Because even though it happens there, it's not as common. And what they determined was that there were some risk factors for dogs to be more likely to have lepto. And here's what they were. Lepto infected dogs were 8 times more likely to have gone to doggy daycare in the last month, and 3 times more likely to have been kenneled overnight in the last month. What that says to me is that if you have more dogs, you have more lepto, right? More energy, more footwork. Nope, but you have more lepto. All right. So yeah, so not only are all dogs at risk because they're alive, if they're a social dog and they have a social life, they're at increased risk. Okay. So now we move to the clinical recommendations. So for the veterinary side, what did they come out with for when we're treating these dogs and when we should be on the lookout and have it on our differential list? Well, number one, they said, you don't need to isolate lepto if you have a case in the hospital. I'll wait for y'all to pick your jaw up off the floor. Okay. Yeah. So listen, they don't recommend it. There's a couple reasons that I'm on board with this. And I actually, even before they came out with these last year, I never recommended isolating lepto cases in the hospital, because if I isolate that dog in the hospital, then I usually, they're kind of, if you think of the isolation area in every clinic I've ever worked in, which has been a lot of them, it's like a closet, right? It's got a door that's shut. It may have a window in it, but I can't see them. And having grown up as an emergency vet, I know that they can't die as long as I'm staring at them, right? So I really hesitate to put something in ISO. But the other part of that is that in their recommendations, what they determined was that the level of care that a pet receives in isolation is a trade-off for them being isolated. They don't get as good, the same level of care. And so that benefit of isolation, because very few, if any, people had any significant risk of exposure to lepto while working and taking care of that isolated pet. So that risk was not outweighed by a benefit. So they said, get them out of isolation. You don't need to isolate them. Now, you do need to be careful and not drink that dog's pee, okay? And you need to also clean it up. Don't leave urine all over the practice, right? Okay. I know, Dr. Mendez, I see you in the chat. What? Yes. You don't need to isolate lepto. In fact, there's only 2 diseases that I recommend isolation for. Okay. Lepto doesn't make the list. Neither does parvo. Okay. Treatment. So treatment for lepto has long been something that people argue about. And lepto is a bacteria, so it's susceptible to almost any antibiotic you want to put it on. But it seems that you get better results faster with doxycycline. I feel like these days, almost everything you should use doxycycline. But doxy 5 mg per kg twice a day for 2 weeks, and you're done. If that animal is not able to oral oral meds, they're vomiting, or their GI tract is already upset, they've got crazy diarrhea, etc., then I think that you should not withhold care and you should use an injectable. Okay. I don't understand people that withhold antibiotics because they want to use one that's only available orally. Get that dog's GI system right and start them on injectable until such time as you can reliably use oral antibiotics and have them absorbed correctly. Okay. The other thing is you should never withhold treatment pending lab results. Just start them on, get your sample, and then start treatment. Okay. There are a couple questions in the chat, so I'm going to look at those right quick. So Josie says, should I be concerned for staff that are pregnant or with low immune systems when they're taking care of an animal with a potentially zoonotic disease? Yeah, listen, I would be concerned for those people anyway. However, don't just be worried or anxious or fearful. Information is the antidote to that fear or that anxiety. Once you understand the transmission and how that happens, then you can break it. It's very easy, especially with something like lepto, because the transmission, right, is that you take something contaminated, which is with urine. So you take something disgusting and you put it somewhere you don't want to put it, like in your mouth, in your eyeball, up your nose, right? Like, no. And so if you can break that transmission, then you should be okay. Staff needs to wear gloves when handling body fluids. I mean, we should wear gloves more often than we do in vet med, but also we should wash our hands. Wearing gloves is not a substitution for washing your hands either. And so wash your hands, change your scrub top. And the same goes for in pet care facilities. Change your top, change your shoes. All of those things are appropriate if you accidentally become contaminated with something that may or may not be infectious. Now, here's the other thing, pet care facilities. Theoretically, you're taking in healthy dogs. You should not be having sick dogs come to your facility, but they slip through, and we understand that. And so anytime you're concerned, if you're at a pet care facility, isolate that dog. You can always take them back out of isolation if you were wrong. But what if you're right? So take action to protect the rest of the animals in your care. Err on that side, okay? But theoretically, if they're coming into a pet care facility, they should be apparently healthy. Okay. So when you're monitoring hospitalized patients, these are the things you're going to look out for. You do want to rerun that chemistry. Now, their recommendation and their guidelines was once every 24 hours. Sometimes I'll wait a little longer because I want to make sure I'm going to see a difference that I can make a decision based on. And if the clients are concerned about the cost of things, let me wait. If the dog's doing okay, seems stable, let me wait another 24 hours so that when I get that result, and if it tells me that they're not improving, I'm confident, right? I'm not saying, well, we can wait another 24. No. Okay. The other thing is that there are some prognostic indicators here. And so when you're looking, like when they were looking at that puppy in that third case, if the serum bilirubin is higher than 10, those dogs are not likely to make it, right? If you can confirm the pulmonary hemorrhage syndrome, which is very difficult for us to confirm in an active clinical case, then that's really high mortality. But really monitoring that serum bilirubin. Now, it doesn't mean that they can't come back from it, but come on now. It makes them, more than 16 times more likely to succumb, right? So if you're getting your crystal ball out and you're looking for, should we keep treating, should we not? At least we now know we have some sort of guidelines on that highway. And I would be upfront with owners and I would share that with them and then let them make that decision. Okay. But at least tell them, right? This doesn't mean that they're dying for sure. It just means that the likelihood is smaller for having that good outcome. Okay. Why is leptospirosis, or the shedding of lepto in urine, why is that an issue? Why should we even worry about lepto shedding? Aren't we vaccinating? And if we vaccinate, doesn't that mean we won't have shedding of lepto in urine, right? If we're only having vaccinated dogs, do we have to worry? Well, it turns out that, clinically normal dogs can just be shedding lepto randomly. Now, it doesn't mean that they are carriers, okay? It can mean that it's passing through their system, their immune system's attacking it, getting rid of it, and out it goes. But they found that randomly. Those dogs were most of the time positive. They had a titer to a specific serovar of lepto, right? The icterohemorrhagiae, that's that L interrogans, icterohemorrhagiae. That's the one associated most often with rats, okay? Most of the dogs that were shedding lepto with a PCR positive in their urine were also positive for a titer in their blood. Okay, that makes sense. I feel like that makes sense. However, some were negative. Some were negative. Oh, all right, on a Tuesday night, that makes my head hurt. What? So what that means is that you should not drink dog urine ever, right? It means you can't, how can you be sure? All right. So I just put this information in here to remind us all that we have a lot of diagnostics available to us. But just because an animal is apparently healthy doesn't mean they can't have something odd passing through. Okay. So, and the other reason I put up there which Cerevar it was is because I do see some conversation in there in the chat as well that I'll get to. But Canicola, so Lepto canicola is the Cerevar that dogs are thought to be the potential maintenance host for, right? Which means that they could sort of carry it, not be apparently sick with it, but be passing it around. But these dogs were positive for a different Cerevar, for Ictero. So these dogs were totally healthy, no clinical disease at all, and just peeing out Lepto all over the place. Okay, so that can happen. So dogs that are clinically normal may be shedding viable leptospires. Yes. Okay. So now we get to sort of the how we win, right? The coup d'etat, prevention. Can we prevent it? And the big question is, as you guys are having in the chat with paragraphs here, which is to vaccinate or not to vaccinate? Are you going to vaccinate? So obviously, I'm board certified in preventive medicine. I believe in vaccinations when appropriate. And actually, I shouldn't say believe. It's not the tooth fairy. They exist. I advocate for vaccination when appropriate. And if a dog is at risk for infection with a disease that can kill it, then I think we ought to offer that vaccination. Now, if I am working at a pet care facility and I'm responsible for safeguarding the health and well-being of all of the pets in my facility, and this is a zoonotic disease, one that we can get from dogs when they have it, then it makes sense to me that I'm going to require vaccination against it, right? Okay. So to vaccinate or not to vaccinate? Well, then the question becomes when. And I'm going to get to the adverse events that you guys are going back and forth, starting with the comment about some vets said that vaccinations are really hard on the dogs. What are the side effects? Should we do it or not? Well, and Dr. Mendez, yes. So Lepto vaccine side effects are no worse than the side effects from other vaccinations. Okay. So the question that usually comes up is, okay, so now we know, and there's lots and lots of data, and I think I'm going to show it to you in a minute here, that we can vaccinate for Lepto. But when should we do it? So I'm going to give you one more case that I just want you to think about. Okay. So this case, and this is a published case report. It's an 8-week-old mixed breed dog in the shelter, born in the shelter. 8 weeks old, it stopped eating, it had a mild fever, and it was dehydrated on the first day of illness. And then it turned yellow. So this dog was jaundiced on day 2. And then it was, of course, it was not vaccinated for Lepto. Then it was titer positive for Ictero and Grippo, 2 of the Cerevars we worry about. It was urine PCR negative, which means they did not find any Lepto in its urine. They went ahead and they started on doxycycline, which is great. That's probably what I would do too. Start that dog on some fluids and doxycycline or an injectable antibiotic. But this puppy at 8 weeks old that was urine PCR negative, because a lot of you that are listening would have said, oh, you should have done a PCR. It was negative, okay? This is your gentle reminder that Lepto is shed intermittently in urine, even in infected dogs. Okay, this dog died in 24 hours. So day 1, it was lethargic and anorexic. Day 2, it turned yellow, and then it died. Day 3, it's dead. That's really fast. That was severe disease. So Lepto can affect young dogs, and you can vaccinate dogs at 8 weeks old for lepto. So it is labeled as safe and effective in dogs 8 weeks of age or older. Dogs are susceptible to infection with lepto at 8 weeks old, or 10 weeks old, 13 weeks old, 16 weeks old, right? It is appropriate to consider vaccinating dogs against lepto at 8 weeks old, okay, to prevent illness, right? So that dog did not have parvo. That dog actually was confirmed to have lepto. Dr. Mendez is writing in wondering about parvo. It's a good thing to test. The dog could have had two things. I agree. Okay, so what I'm getting at is that we know the dogs can get lepto before they're, 16 weeks old. We know that those dogs actually develop pretty severe disease, right? 90% of the acutely fatal lepto in that one paper, those were in dogs less than 6 months of age. And we know that the vaccine is effective in dogs as early as 8 weeks old. So we can give it at 8 weeks, we can give it at 12 weeks, and then we can give it at 16 weeks as well. So yeah, and they're not all labeled for safe and effective use at 8 weeks old. So you need to look at which one you're using, but you need to be vaccinating dogs at 8 weeks old. Okay. All right. So here's where we get to the issue, right? All of those adverse reactions that people talk about. All right, get ready. Here comes the data, because I feel like all of you out there are data lovers like me. So first of all, we have to agree on what is an adverse event. It's not just, the dog falls over, as I remove the needle from giving the vaccine. That's not it. It's everything is considered and included when we talk about adverse event rates. They scratch where they got the injection. The owner perceives that they're sore in that leg. They sleep more that evening, right? They're a little bit more lethargic. It can also be all the way up to the basketball-sized head, right? Angioedema, the fancy word for the basketball-sized head swelling, like an endotoxin that we used to see. But it's all of those things. All of those things are included when we talk about it. So there was a big study. Some of you probably have seen this study. This was done in 2005, and they looked at a lot of different vaccines. They had over 1 million dogs enrolled, more than 3 million doses that they looked at. The total adverse events was less than 5,000, which puts it at 0.38%. Now, they did find some risk factors in this study in 2005, and they said, listen, the more vaccines you give, the higher your odds for an adverse event. Well, duh. Okay, duh. Because remember, we're looking at everything. So if I give that dog 3 different vaccinations that day, if I give them their DHLPP, if I give them their intranasal, and I give them their rabies, and I give them their CIV, they're probably going to sleep that afternoon, right? That's an adverse event. Okay, they sleep. They're lethargic. All right. And they also found smaller dogs more likely to, like smaller by body weight, more likely to have an adverse event. That makes sense too. Because remember, we're including all of those different adverse events. I think they're sore. Owner perceives they're sore. They scratch at the site, yada, 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 as well as the things we really worry about. All right. But what they also found is that having lepto or vaccinating for lepto was not a risk factor for an adverse event, which means you should not withhold a lepto vaccine because you're worried about an adverse event in general. That's not a reason to skip lepto. Okay. Having lepto in your DHLPP does not increase the risk for an adverse event from that vaccination. Okay. So then the same group of people, those same guys, got the band back together, and they did a repeat of this study in 2023. Some of you may have seen this publication. Some people call it the Banfield study, right? Because they looked at that's one thing that these giant corporate entities can do. They can pump out massive groups of metadata. So there was over 4 million dogs, right? And when they increased their sample size, almost 20 years later, different vaccines, right? They increased their sample size. They had an even lower adverse event rate. So instead of 0.38%, It was 0.19%. It was even lower, right? I do hate to say that what they discovered was something that Cosette and I do not like, but that the largest adverse event rates were in French bulldogs and dachshunds, to which Cosette gives her side eye here, right? Really? Really? All right. But I also want to remind everybody that these were owner observed largely, right? I feel like my dog is lame on that leg till tomorrow, right? I feel like they're scratching more at it. I feel like they're more lethargic and they just don't feel good. So some of these are very subjective. Some of them are not. Did they get vomiting and diarrhea? Those are not subjective, right? Okay. But they looked at all of them and they discovered the same thing. All right. So vaccinating for lepto was not a risk factor for an adverse event. Okay. What about the cases that we looked at, right? Like, why did I show you those cases? So if we look at these 3 cases, by the end of this, you know, the threat of leptospirosis is real. All 3 of these cases could have benefited from vaccination and from sticking to the manufacturer's guidelines, right? Whether the dog's young or old, right? I would either have been able to move lepto lower on my differential list if I knew they were vaccinated. They would have been protected from disease, right? In the case of the first 2, maybe mama dog could have been vaccinated for that little puppy, right? So all of these would have benefited. So I want you to if you get nothing else out of tonight, I want you to get out of this that you should consider lepto more often, either as a differential in your sick dog visits. In your well dog visits, please encourage uniform vaccination with lepto, against lepto, because if a dog is alive, it's at risk for lepto. If it's a social dog, increased risk, and for puppy visits. So for me, I have 1 puppy shot, and it's a DHL 4 PP. I vaccinate them at 8 weeks, 12 weeks, and 16 weeks with that. Yes, I know, but that's what I do, and those dogs are protected. It also keeps me from making the mistake of like, did it get lepto? Did it not get lepto? Did we grab the wrong one out of the fridge of many colors? No, I just have 1. This is what we give. We give a combination vaccine that has lepto in it because there's no reason not to. The adverse event rate is the same, whether you have lepto in it or you don't. So I give it. Okay. So I also want you to consider, whether you're a veterinarian or you're at a pet care facility, why and how you recommend or require a vaccine. Is it just based on cost? That's not our decision. That should be the client's decision. Is it good medicine and risk assessments? Oh, be still my heart. That's how we should do it, right? Is it on relationships? Like, well, we picked that one because we have a good relationship with that sales rep. That's really less than ideal, friends, right? I mean, nothing against sales reps, but for the most important thing we do as veterinarians, and the thing we do most often, what the general public just looks to us to do, is to prevent disease in dogs, right? And cats, but dogs. And so the most important thing we do is select a vaccine to use for our patients. We should really try not to make that decision this month based on a $5 change in price. We should make that decision based on science and data, and then make that risk assessment for our patient. And at pet care facilities, when you're generating your list of required vaccinations for entry into your facility, it shouldn't be because you're afraid of the client getting mad. It shouldn't be because you just don't want to hear another complaint about this. It should be because you take very seriously your job, your role in protecting the health and well-being of all the pets coming into your facility, which means you can't make those exceptions because that puts everybody at risk. I know this seems like I'm really being intense about it, but this is what our clients expect us to do, whether they know it or not. And no one gets mad until it doesn't go right. And then they get really mad, right? So think about and make a conscious decision on how you're doing this. Okay. So now I'm going to look at questions. If you guys will type it in. Okay. So listen. So I'm going to go to this one first here. Stephanie typed it in. She says, we, Stephanie, I'm presuming you're at a pet care facility, can only require the vaccines our vets will give. That's true. And so veterinarians, if you have something come through from a facility and it says that we require this, please either reach out to that facility and ask them why, right? Or if there's medically no reason you can't give it, just give it. If you're worried about an adverse reaction in that dog in particular, pre-medicate the dog, friends. We know the vaccines are effective in the face of pre-medication because the dose is so low. We know they're effective. Just pre-med the dog if you're that worried, right? Let's not get into a fight about control over who's going to say this and who gets what. Because in the end, neither one of us, the pet care facility or the veterinarian, are in charge of that. It's the client. They're in charge of what happens. We're not in control. And so please work with facilities in your area. Ask them why they're requiring this. They may have a great reason you didn't know about. They may also not know why they're requiring it and be happy to take some input, right? Okay, so that's my soapbox. I'll put it away now. Okay, so Dawn says, once you complete the Lepto 2 or 4 series, can you titer after, or do the vaccinations need to be repeated? So you can do a titer after, but titers are not the be-all, end-all for immunity assessment. You have to repeat them every year, right? We know that for bacteria, this is a bacterial disease, right? So technically it's a bacterin, not a true vaccine for a virus. It's a bacterin. We know that the titers provided or produced by these vaccines drop off a cliff after about 14 months. So these are ones that you have to keep up to date on. And so if you're more than 2 months overdue for that annual booster, then you got to start over with a series of 2 for that. I would just revaccinate. It's cheaper. It's easier. Why would you not do it? And you can also give it early. So you can give it at 11 months after the last one. That's okay. What you can't do is give it at 15 months because it won't be effective, right? Let's see. And Joe, I require cover of all vaccines as we are social and rural. Okay, so Joe, thanks for bringing that up. I'm going to address that right quick. The fact that urban and rural, and that's a data point that I didn't put in here, but we know for a fact that the 3 risk factors for lepto infection are in dogs is if the dog lives in the city in an urban area, if they're less than 15 pounds, their body weight, so little dogs actually are more at higher risk, and if they're not vaccinated. So when you live in the city, you're actually more likely to be infected with lepto, so you should be vaccinated for sure, versus a rural dog. So it's not like 30 years ago, right? That shift has happened in the last, well, let's see, that paper came out probably 10 years ago with that shift in the signalment. So yeah. Jenny, is this transmitted to humans only through mucous membranes, or can it infect through skin contact? What are the human symptoms? Great question. Very great question. So mucous membranes is the number one way it's transmitted. So you get it in your mouth, in your eyeball, up your nose, something like that. However, if you have a cut in your skin, you can contract it that way. There were actually 2 published case series from the CDC in the last 15 or 20 years. One was adventure racers. So they jogged through a marsh and through sawgrass, and it got cuts and stuff on their legs, and there have been feral hogs there. So the theory was that the hogs were actually shedding lepto, because up to 30% of feral hogs in Florida actually are positive for lepto. And so a lot of those adventure racers came down with lepto from jogging through that marsh. So while it cannot penetrate intact skin, if you have a cut on your hands, it can. So if you have cut on your hands, or if you have 10 seconds before you go to handle urine, put on gloves. Put on gloves. It was mentioned in the chat earlier, put on gloves. So the symptoms of lepto in people can be sort of nonspecific. It can be urinary tract infection. It can produce liver disease, so jaundice, lethargy, anorexia, vomiting, diarrhea, all those things. In fact, there was a lady in Florida she actually came down with lepto. They couldn't figure out what it was. She slipped into a coma. Her family member took her dog because the dog was peeing in the house. They had come to visit to take care of her because she was really, really sick. Took the dog. The veterinarian said, "Why is the dog here?" Long story short, the veterinarian called the tertiary care facility where the lady was hospitalized and said, "Hey, her dog might have given her lepto because it's got lepto." It was lepto. That lady had lepto. So you can have escalation of clinical signs. How long does it live outside the body? It can live a long time outside the body. In fact, because it's a bacteria, not a virus, bacteria actually can reproduce outside the body. Viruses need a host to help them to reproduce. So like if I have in my Dr. Pepper can a bunch of flu virus, I come back 12 hours later, I will have the same amount or less flu virus. If I put lepto or salmonella in my coffee or my Dr. Pepper can, and I come back in 12 hours, I'll have more of that bacteria because bacteria can reproduce on their own outside of their host. And so they can survive for a good long while in their environment, especially at their optimum temperature. So it's another reason not to lick doorknobs or other things, right? And so you do have to be aware. I'm not sure exactly how it can live a good long time outside the body, right? Days. So waiting for it to become inactivated in the environment is not a good plan. Melissa, I work in a dog boarding facility. Wear gloves. Yeah, it's not It's not a weakness to wear gloves. It shows that you understand what's going on. Don't touch your face too much, and wear gloves. And change your gloves often. And sometimes before you take your gloves off, wash your gloves. Right? Especially you got super disgusting stuff all over. Wash your gloves, then take them off. You're less likely to actually cross-contaminate yourself while taking your gloves off. Okay, so let me get you guys. Sorry, I should have put this up earlier. Veterinarians, you can get your CE, and I think Janie's going to pop on in a minute and give the PAC CE code. So you have to use Chrome. You cannot use Safari. You must use Chrome for this to work, veterinarians, to get this. Thank you so much to Merck Animal Health for providing the RACE CE for us, which is wonderful. And if you have trouble, you just, go to that website. I feel like we've all done this so many times. Go to that website, you put your information in along with that special code, and you'll be able to download your certificate. If you can't get it, hey, it's only for live people. If you're watching the recorded version, you can't get it. It's only for live. But I think it actually will work with Firefox as well. If it doesn't, Dr. Keel, shoot me an email and I'll get you that information and help you get it. It can be for everyone. You can go get that CE certificate, no problem, Melissa, because it's for technicians, assistants, everybody. You can get that. But for PAC folks, I think if you're going to use it for your PAC CEU requirements, you're going to need the code that I think Janie is going to give us any second.
Yes. So did everybody get at least take a picture of this? I just want to make sure that we've got this taken care of. I can always flip back to it, but I will go ahead and put up the PAC. Now, of course, this is for anyone live or who is watching the replay. This is the code that you will need to get your PAC CEU. This was wonderful. A lot of information. I have a lot of notes now to go through. So I think you cleared up things for a lot of people. So thank you very much for spending the extra time and going through everyone's questions. Also, this has been very helpful.
Yeah, it's wonderful. And also, folks, if you have questions, especially if you're at a pet care facility, please head to my website, drjenthevet.com. And if you're interested in enrolling your facility in my Healthy Pet Keeping Seal program, which includes training for your people, discussion about what your requirements are, what they could be, and how to make that happen with your veterinarians in your area, just reach out to me through my email there.
Yes. Thank you, Dr. Jen, and thank you from PAC, and thank you everyone for attending this evening.
Okay. Oh, let's see. Website pick. Can you put that for the veterinarian CE? Yep. There we go. We just had someone just ask.
There we go.
Okay.
Yes.
So we'll leave it up for a minute, maybe.
Got it. Okay. Yeah, we can certainly leave it up there.
Okay. All right.
Wonderful.
Otherwise, officially, I think that's all we have, but we'll leave that up.
All right. Take a little picture with your phone so you can keep a hold of it. I think the QR code just goes to that same website, right?
It does.
Okay.
It does. Yeah.
Wonderful, everyone.
All right. Good
Thank you
night,
very much.
everybody. Thanks for tuning
All right.
in.
Thank you.